Okay, so hello everyone and welcome to our scholarly snippets session on qualitative research. My name is Molly Montgomery and I am the Director of Library Services at the Idaho College of Osteopathic Medicine, and I am a die-hard fan of qualitative research, so I'm really excited to talk about it, and I'm going to try to get as much as I can into 30 minutes, but just know this will be a very high-level overview, but I'm going to leave you with some resources towards the end to expand on this so you can dig a little deeper when you want to. Okay, so about this webinar and the series of webinars. So the Scholarly Snippets series were developed by librarians at osteopathic medical schools with the goal to help our students, our faculty, our clinicians advance their research skills and support scholarly activities. But we have expanded that and we welcome anyone, even if you're not affiliated with an osteopathic school. We have a lot of librarians who attend these, so we're really happy to have anyone here. And to try to get a sense of who is here today, we are going to put up a poll and just describe the role that you filled maybe the most at your current institution. And we'll let this go for a little bit. Looks like there's about 20 of you here now. Oh, it's a race between faculty and librarians. Okay, it looks like about everyone's participated, and it's a pretty good division between faculty, librarians, staff, and students. So that's great. Happy to have everyone here. So go ahead and end the poll and share those results. Okay, oops. Okay. So for today's session, our objectives are, I want you to be able to describe qualitative research and the role that it plays in medicine, healthcare, and medical education, to examine some of the different qualitative research methods, and to identify qualities of a trustworthy qualitative research article if all you really want to do is be able to read qualitative research. So what is qualitative research? A lot of my quantitative research companions and colleagues will say it's something like this. It's rainbows and butterflies. You guys just talk and you talk about feelings and experiences. And so all it is, it's just very touchy-feely and it's not a real research methodology, which I beg to differ. And most of this presentation will be about trying to demonstrate why qualitative research is truly its own research methodology. So no, really, what is it? Not just rainbows and butterflies. Very basic. Qualitative research is really looking at words, images, observations, things like that, versus actually looking at numbers and quantitative information. Qualitative research really seeks to understand the answer, sort of the but why questions. So you may do a quantitative research study and you're left with this, well, we have all this data, but why are people doing this? Why do they feel this way? What are they experiencing? Qualitative research uses themes and metaphors and really focuses on the individual experiences of specific topics and phenomenon. And qualitative research is much more about depth than breadth. So it's really about digging deep into a particular topic or experience. So why do qualitative research, or why should you use qualitative research? One of my big points is that qualitative research is research. It is different, but it is valid and it's its own research methodology. And sometimes you're going to need more than numbers and data. Sometimes you need that context. Sometimes you need more nuanced information. And I feel it's a really important part of a well-rounded research strategy. It's great to have quantitative data, but sometimes you need that deeper level of understanding. And I have been teaching qualitative research to lots of healthcare students and clinicians and professionals for many years. And so part of my very long game is to try to combat anti-qualitative bias, where a lot of medical people in the medical field really are like, well, if it doesn't have a p-value, it doesn't count. And I definitely think that's missing a really big part of research and some additional information we can have. So I have seen a bit of a switch in the last 5 years or so about qualitative research being much more accepted in medical research. So here's an example of kind of what I mean. So here is a research article that's a quantitative study. They did a survey looking at colorectal cancers, lung cancer patients and survivors, and who is smoking. And so you see that line where 14% of patients with lung cancer and 9% of patients with colorectal cancer were still smoking after diagnosis. And a survey can help you answer some of these questions, some of the why questions, but patients can only, or participants can only answer the questions they're asked. They can't really go off on tangents, and they can't give you really nuanced information. So if it's things that you're not thinking to ask, they may never get answered. And here is a qualitative study that looks at a very similar topic. So they did interviews with patients who were surgical lung cancer patients and their views about smoking. And you can see that some of the patients indicated smoking was enjoyable. It helped with coping or had health benefits, which is probably something you wouldn't have thought to ask about in a survey. It also talks about how they just demonstrated a fatalistic attitude, but they still wanted healthcare professionals to counsel them about stopping smoking, which again, you may not have seen this in a survey, but you can get that when you're actually talking to people. So here's a really good table that talks about the main differences between qualitative and quantitative approaches. And I'm not going to talk about all of these, but I will pull out a few. So one of them is that realities are multiple, constructed, and holistic in a qualitative approach. That means we all have a different reality. We all have a different approach. And these are constructed based on our experiences in our lives. And you can't take one piece of that out of it. You have to consider the whole picture. But quantitative is really much more about reality is single. We have one view. It is tangible. We can measure it. We can also divide it and study one piece without thinking about the rest of the pieces. And that's just not the way that qualitative research does it. This is where quantitative people get really anxious about qualitative research, is that quantitative starts with a hypothesis. That's the whole basis for quantitative research. That's hypothesis testing. But with qualitative research, we may have some ideas as we're starting our project, but we don't have a formal hypothesis we're testing. Usually you collect all the data and you come up with that at the end as you're analyzing the research. Qualitative is inductive and quantitative is deductive. And that's really about where are you coming up with your theories. And so with quantitative, you are testing theories. You're collecting data to test those theories. And inductive, we are coming up with theories at the end that may help explain what we found. And the final one I'll talk about is maybe why I initially really liked qualitative, is because there's not a lot of numbers. And I hate statistics. I hate to say it. I'm not as much as I used to, but it's not my favorite thing to work with. And so I really fell into the qualitative path because I'm like, okay, I'm talking to people, which I love to do. I don't have to worry about confidence intervals and t-tests and all this sort of stuff. But there's good and bad in that. And we'll talk about that in a minute. And of course, quantitative is quantitative. It really talks about reducing what we found to data and numerical indices. So let's say you're interested. Maybe this is something that you would like to try. So let's talk a little bit about the basic steps that go into starting a qualitative project. The first one is selecting a topic that would make the best use of a qualitative approach. This might be where you have noticed something in your setting. And maybe you've already done a basic quantitative, like done a survey, but you need a deeper or more nuanced understanding of that phenomenon, of that topic, of what's going on in your setting. So a qualitative approach might be the way to go. Then you'll go out and you'll review the relevant literature. I would pull both quantitative and qualitative studies. If you are new to qualitative research, you really want to then read the qualitative articles and spend a lot of time digging through the methods section. This is something that's new to you that's really helpful because you'll get a sense of how people have done that kind of research before you. And I found that really enlightening and gives me a sense of how I want to proceed. And with qualitative research, you also have to choose what they call a philosophical framework. And these look like this. These are the primary philosophical frameworks for qualitative studies. There's the three big ones, which are phenomenology, grounded theory, and ethnography, and they all each have their own focus. With phenomenology, you're really trying to understand the lived experience of a person going through a particular thing or phenomenon. With grounded theory, it's more about the process, and you're coming up with a theory at the end to try to explain it and maybe apply it largely. And with ethnography, you're really focused on the cultural aspect of a particular experience. Historical is a thing, but I don't see that a lot, and that's probably not what a lot of you will be looking at. Here's the same three main philosophical frameworks in a different table. I love tables, so I'm so sorry. They can explain it a lot better than I can. And so this one is actually specific to medical educators. This is a great article. So I would pull this if you want a good understanding, really high level understanding of how to do qualitative research in a medical education setting. But they have the different columns for ethnography, phenomenology, and grounded theory. And on the left-hand side, they've talked about what the definitions are, some examples, some of the great resources if you want to learn more about it, and some sample research questions. So all of this is really helpful to try to understand those frameworks and the framework you might want to choose to help define how your project will proceed. Okay, so you've gotten to this point. Now you have to figure out, how do you want to collect your data? Traditionally, what everyone thinks about when they think about qualitative research is doing an interview or doing some sort of focus group. Interviews, of course, are that one-on-one setting where you're either in person, on WebEx, over the telephone, some sort of way where you and the participant are kind of having a conversation, or you're asking them questions. A focus group, that is a larger group, generally no more than 10 ideally, because it kind of gets out of hand, in really big focus groups. And you'll have a couple of researchers, one or two researchers generally, who are asking questions of the group. And there's pluses and minuses of both of those, and we'll actually go into that in the next slide. Some of the question structure, you can have a semi-structured, which I think is a lot of what interviews and focus groups do, where you have a list of questions you've worked out ahead of time and you work your way through that, but you're okay going off on tangents or going on different directions if that's what the participants do. Then you have also video or audio. So it's not all just interviews and focus groups. There have been qualitative research studies on speeches, like presidential speeches, over the years to see how they changed in themes and tones. People have done qualitative research on commercials or YouTube videos. There's just a lot. If it's text or audio, then you can do a qualitative study on it. And speaking of that, text analysis is another way to do qualitative research. Traditionally, we were looking at journals, and some of these are being prompted by the researchers, and some of them are being found later. So that might be more of a historical research project. But more recently, a lot of people are doing qualitative research on tweets and Facebook comments and the things they're seeing in social media. I was in a class last year where we had to choose a topic, find some news articles on it, and then do a qualitative analysis of the comments on those news articles. What they say never read the comments, and they're totally right. It was a challenging topic. Okay, then this is a little more controversial, where some people consider responses to open-ended questions on surveys to be qualitative data because it is text, but then others say that it's not really qualitative data because it tends to be very surface or high level, and you don't really get that deep information that you do from these other sources. So you can analyze it. You can add themes and codes to it if you want, but it does tend to be a little more surface or high level. And I've also seen document reviews where people look at syllabi or mission statements for schools to try to analyze some themes and see what is maybe different between, I've seen MD and DO school mission statements versus PA schools to see what the differences are. So I'm not going to go through all of the bullet points in this, but I think this is a good table to understand the advantages and disadvantages to different data collection methods in qualitative research. And I didn't talk about observation in the last slide. That does get used. It's not as much in medical education or medicine. This is more anthropological in nature, but there certainly is a role for that. So you're welcome to dig a little deeper into that if you're interested. Okay, so you've gotten this far, you've chosen your method, and now it's time to recruit your participants. And this is another one of the many ways that qualitative and quantitative studies are a little different. So with qualitative studies, you have what's called purposive sampling, where we are purposely choosing people that will give us the most information on our research question or the topic that we're trying to learn more about, which is very different from quantitative, where we're looking to have a representative sample that has been randomized and all that sort of stuff. No, we're trying to get at the very heart of the matter and try to find people who are going to best answer our questions. So you may have a few people that you've recruited and have agreed to participate. Now, what I've done in the past and what other researchers do is what's called snowball sampling. So you ask your current participants if they know anyone who is also either experiencing something similar, has similar feelings, and if they could ask them to join the project as well. Something that you also want to find in doing qualitative research is to find negative cases, which are I'm doing a research project right now about negative attitudes that osteopathic students have towards research and why they may have those attitudes. And so my negative cases were actually positive cases where I was trying to recruit students who also have very positive feelings about research and try to get a sense of what's the range there and what are the differences. With qualitative research, if you've have any experience doing them or reading about them, you will know that sample sizes are generally very small. With an interview, maybe 20 people, maybe 30. If you get more than that, it's just overwhelming amount of data. With focus groups, it may be you have like maybe 50 people total that are participating in different focus groups, maybe a little larger, but not a lot. And you don't generally, like with quantitative studies, you're usually trying to hit a particular number to make sure your study is adequately powered. With qualitative studies, we don't do that at all. It's much more about what's a range. And so the study I did, I was like, well, I don't want any more than 20 because it's going to be unmanageable, but I want to get at least 15. And then you keep going until you reach what's called saturation. That's where you're not getting any new information from your participants. Like all the questions you've asked, nothing new is coming up. You're not learning anything new. Okay, so then how do we do the data analysis if we're not able to put it in SPSS or some sort of statistical thing? Well, you are the data analysis. Like you're the thing that's actually having to do the analysis yourself. So that's good and bad. A lot of flexibility and creativity, but a lot of work. So the first thing you do, like say if it's an interview or a focus group, you have to transcribe the audio of that. And then you need to read through the text. You immerse yourself in the data. So reading through all of those interviews multiple times to try to get a sense of what's going on here before you even start to do anything like coding. And that's the next stage where you will be applying initial codes. And codes are terms or phrases that represent bigger concepts within what the participants are sharing with you or saying. Then after your initial coding, you read through it again or look through your code book, which is what your list of codes is called, and you build categories from those codes. And so ideally, your codes the number of codes get smaller, but your categories get more inclusive. And so you kind of get a sense of what's the bigger picture from your data. And then finally, you're creating this overall themes from the data that you've collected. And usually you may have, 3 to 5 big themes that are coming from your research data. And in some cases, but not all, that at the end you will come up with some sort of hypothesis or a theory to help explain your findings. That doesn't always happen in all qualitative research projects, though. Just some general notes about data analysis with qualitative research is that it is very iterative and inductive, which means you are learning things as you are going. You're not deducing things, you're trying to induce with the information as you're doing it. It is all ongoing, so you analyze the data as you're going. So that's definitely something we don't do in quantitative research. You wait till the end basically to do all your data analysis, but this is really helpful to analyze as you're going, because then you get a sense of, oh, this isn't working, this question doesn't work, we need to change it, we need to modify it. So to that last point on this slide, it's very flexible. And something that's important to know is that the researcher is not separate from the research and qualitative data. You are a part of the research because generally you are asking questions and learning more information. And so that means you need to be reflexive about your role in the research process. So if you are a person who is interviewing your participants who have maybe less power than you, so maybe you're an instructor and your participants are students, they have less power than you, there's a differential, they may be responding to you differently. And of course, there's little to no use of statistics. Hooray for that. Some of the qualitative data analysis tools are listed here. These are just some of the really well-known and big ones, like in vivo, ALICE-TI, MaxQDA. Some of these are very expensive and some are less so. So there's varying price points. For my project, I priced out all of them and found that the last one, Deduce, was very affordable. For me, it's $10 per month per user on a project. So compared to in vivo, which quoted me $5,000, like Deduce is much better for me. And depending on your institution, some really large institutions have institutional subscriptions to some of the big qualitative data softwares. Some of these are very complex and maybe more than you actually need. Or maybe your project is complex and you need to have that level of functionality. And you may look to see some of these work better with teams of researchers and some are a little more challenging with teams. And if you have absolutely no budget and your project is fairly small, then you can totally get away with coding and analyzing your data in Word or Google Docs. It's not nearly as pretty and it doesn't have nearly the features that a normal qualitative data software analysis tool would, but it is possible. I've seen it done. This is an example of my project in Deduce. On the left, you have my codes, or what's known as my code book. And so this is my first pass. I immersed myself in the data. I read through it several times, and then I started reading it and applying codes, or again, those short terms or phrases that I think get the essence of what my participants were saying. And so the excerpt here in the middle is about, this is just one of their responses, and then I coded one of the sentences to be talking about the benefit of research. So a lot of people are like, well, you don't have to do statistics, so it's easy. No, it is not the easy option. As someone who has been working on this project for a year for something that was supposed to take a number of months, there's just so much data. And it can take hundreds of hours of your life to get through all that data because you can't put this into SPSS and just get the information. You actually are the one doing all the analysis. So like I said, all the analysis and none of the math. So sad. I'm not going to talk about this. I just wanted to make sure I put this table in here because I don't think we can talk about qualitative research without talking about mixed methods research. This is where your projects includes both a quantitative and a qualitative piece, and that can look different. You can start with quantitative and end with qualitative, do that vice versa, include them like parallel or have them nested. And I really like this particular table, and that article is really good too if you're looking to learn more about mixed methods research. Okay, the final thing I'm going to talk about, which I'm doing, oh, gee whiz, okay, 6 minutes. We're going to talk about evaluating qualitative research because maybe you never want to do a qualitative research project, but you're probably going to be reading them. And so there's 4 main things to look for when you're trying to evaluate qualitative research. That includes credibility. And when you're looking at quantitative research, like a randomized control trial, they usually talk about validity. But we don't look at that with qualitative. It's more about the credibility, or what's the truth of the research findings. Did the researchers really capture what the participants or what the data was saying? Then we look at transferability. Can these findings be generalized to other settings? And since qualitative tends to be very small and specific, they can't always, and that's okay. But sometimes you can find ways to make it a little more generalizable. Then you're looking at dependability, which is how stable are the findings from multiple perspectives. And when reading qualitative research, it's helpful if there's multiple researchers looking at the data, coming up with their own conclusions, and then discussing maybe any differences or similarities with each other and coming to an agreed upon conclusion. And then last thing is confirmability, which is how transparent was the research process? How much detail did they go into about the decisions they made, why they chose one theoretical framework or another, why they chose one method of collecting data over another. You just want to see a lot of detail. This is another table that I really like because a lot of these terms are unfamiliar to those of us who are maybe more familiar with quantitative research, because you don't see things like this when you're looking at like a randomized control trial, but you see these terms a lot when evaluating qualitative research. And the more of these they talk about, the happier I tend to be with that article, because it makes me trust, again, their process, and it makes it more clear what they're doing. One of the questions that got sent to me prior to this presentation is like, where does qualitative research fit on that evidence pyramid? And the answer is nowhere really, but it should, because the evidence pyramid is very quantitative in nature. But qualitative research does have its own hierarchy based on basically higher level is that which is more generalizable, and lower level tends to be something like a single case study that doesn't really maybe applicable to other settings. Okay, so summing up, qualitative research is a great method to understand the whys, to get maybe deeper into the context of whoever it is you're studying. We focus more on credibility than validity. And if you do want to do qualitative research, I encourage you to go out there and enjoy the rainbows and butterflies. It's a lot of work, but also I found it to be very rewarding and a lot of fun to do research in this way. If you want more information, because 30 minutes is definitely not enough, these are some of my favorite qualitative research books. The first one is so great. If you're brand new, they spell it all out, and it's very approachable and really like clear language. And the coding manual's amazing if you've never coded before. So those of you who registered, you will get an email asking for your feedback on this session. Please give us all the feedback, even critical. We're always here to learn more. Our next Scholarly Snippets webinar is December 7th. It's on how to find research instruments in the database called HAPPY, and you can register there at that link. Okay, so with 2 minutes left, since you might not have a lot of time to ask questions, I do have my email address here. Please contact me if you have any questions about qualitative research. I love this stuff, so I'm always happy to talk about it. But are there any questions in the time remaining?
There is one question in the chat of how does qualitative research handle biases?
That's good. A lot of that is that researcher reflexivity, because all of us go into any research endeavor with our own biases. We're built into that. And so usually when I'm reading a qualitative research study, I look to see how reflexive were they? How did they address that? How did they talk about how maybe like in a research study on vaccine deniers, I usually want to see some sort of comment about the researcher saying, this is the emotions that brought up in me. I was very defensive, and these are the steps I made to try to make sure that that didn't translate into my interview. But yes, the biases are there because it's so based on individual perspectives, but you're kind of looking for some of that stuff like member checking and triangulation and things like that. But good question, Nicole. Okay, any more questions?
I will add in, my dissertation was mixed methods and it was sequential. And the first part was the qualitative side, but addressing like bias, I was doing, it was a study, so qualitative and quantitative on measuring clinical competency. And so on the qualitative side, I ran 2 national Delphi panels. So how I dealt with bias was one, you had to be nominated. So you had to be recognized as an expert by someone to get on. So we just didn't have someone who had, because we have a lot of people who have opinions, but it was expert opinion. And then the second was because medicine's practiced differently across different regions in the country. So it's trying to kind of like quantitative that and in my write-up about, I covered these regions. So it's this region's perspective on this. And so I just want to throw in, those were a couple of things. in there about dealing with bias. But like you said, it is just being straightforward, being able to talk about.
Yeah. Thanks, Charles. I appreciate your perspective. It's really helpful.